The kidney produces some hormones, extracts waste from blood, balances body fluids by absorbing certain minerals like sodium, forms urine to excrete from the body as fluid waste. The renal artery carries blood from the heart to the kidney to be filtered. The renal medulla is the innermost part of the kidney. It's split into the renal pyramids, which house thousands of nephrons. The renal cortex is where in the kidney where blood is filtered to remove harmful or unwanted substances out of the body. The renal calyx, this is where the urine formed in the kidneys passes through the renal pelvis and into the ureter. The ureter is the tube that urine passes from the kidneys to the bladder. The nephron is the functional unit of the kidneys. It regulates water and solute levels in the blood by filtering the blood, reabsorbing needed materials, and excreting unneeded materials. The glomerulus is the unit that removes everything from the blood. The Bowman's capsule is the site where blood is first filtered into urine. The proximal convoluted tubule is where fluid in the filtrate is reabsorbed into capillaries because of sodium reabsorption into the lumen. The loop of Henle recovers water and sodium chloride from urine so that any unwanted contents in blood is filtered out. The concentration of antidiuretic hormone affects how permeable the loop of Henle is to water. The descending loop collects water to regulate fluid levels. The ascending loops collects solutes such as excess potassium to regulate the blood pH. The distal convoluted tubule is the most distal part of the nephron. It is responsible for reabsorption of sodium and water and secretes hydrogen potassium to regulate fluid levels in the body. The collecting duct collects urine from the nephrons and will direct urine into the renal pelvis and the ureters. When you eat solid food, for example, a hamburger, your digestive system breaks down the components of your food into usable nutrients that can be absorbed into the blood. The kidney would control how much of the water and sodium that you're ingested would be absorbed to be used by the body, or how much of that sodium would need to be filtered out and excreted as waste because it is not needed. This also affects blood pressure because change in solutes in the blood will affect blood volume. When you drink something, such as a delicious glass of water, your digestive system will absorb most of the water in the digestive system, and it will be diffused into the bloodstream. Depending on how much water you drink, your kidney would control how much of it needs to be reabsorbed into the body and how much needs to be excreted as waste because the body does not need it. A common disease in the urinary system is kidney stones, also known as nephrolithosalis. A kidney stone is a hard crystallized minerals or acid salts that form in the kidney or in the urinary tract. Kidney stones form when there is a decrease in urine volume and or there is an excess of stone-forming substances in the urine. This makes the urine very concentrated and allows minerals in the urine to stick together and crystallize. Usually, kidney stones are calcium oxalate stones, which occur because oxalate is a natural component in lots of foods like chocolate, nuts, and fruits. The liver also produces oxalate, so if a person is eating a high oxalate diet, they are at higher risk of having urine with concentrated calcium and then forming kidney stones. When the person is told that they have kidney stones, they need to avoid overeating of foods that have high oxalate content to decrease their urine concentration and drink lots of water to even further dilute their urine concentration. After a while, the kidney stones will pass or will be removed surgically or with ultrasound waves. With a regulated diet and regular hydration, they will not return.